The best time for a person to get their cataract done is when it's starting to interfere with their daily activities, their visually dependent activities. My name's Dr. Michael Hennessy. I'm an ophthalmologist. My job includes consulting with people, examining them to discuss their eye health and any eye problems, and I perform surgery, mostly cataract surgery, dealing with people's lens opacity to get them back good vision. Cataract is a cloudiness or opacity of the lens of the eye. It means that the light isn't forming a sharp focus because it's being scattered within the lens and therefore not forming a focus at the back of the eye on the retina. So people will start to notice things are getting a little difficult with their vision, things like reading, driving a car, being able to recognise spaces at distance, difficulties with glare in nighttime driving and other glare situations. Some of those symptoms may be fairly subtle at first, and the person may be warned about them as part of an eye exam, and the issue then becomes watching for them getting any worse and when they're starting to interfere with people's confidence. As I call it, when your vision gets a bit fussy and you feel like you've got to pay more attention to seeing well. So basically, almost everybody will benefit from cataract surgery. The context will be very important depending on a whole range of factors. It's a very individual decision based on a person's needs, their health, social circumstances, support. There's many layers to the decisions. If people have got other eye problems, then the timing of cataract surgery relative to other ocular health issues might be very important. And to some extent, if people have got to be much older and have got some cataract but are functioning well, may not benefit a lot from it being done, there'll be times when perhaps it's better just to leave the cataract alone. And what's, I think, almost unique about cataract surgery is it's a sort of fix and it's permanently fixed. It's worth keeping in mind that it is an artificial implant in the eye, but the reassurance people have about that is it's a very well-established technology. So it's permanent, lasts forever. About the only thing that may happen because it's artificial is for some scar tissue to grow behind the lens implant, and that may need to be cut away with a laser, and that might be about 5% of people. That's certainly our aim, but again, more specifically, there'll be a discussion about a person's visual needs and what will work for them the best in terms of their surgery and what focus we give them. So the starting question can be, how motivated are people to reduce or eliminate the need for spectacles? And then it'll be quite a detailed personal discussion about their visual needs, their hobbies, activities. The best time for a person to get their cataract done is when it's starting to interfere with their daily activities, their visually dependent activities. And that will be a very individual decision for every patient. Some key activities can include things like reading and being able to drive competently. Now, taken to its extreme, a cataract left to just get worse and worse is a form of preventable blindness. So it's worth knowing that a cataract can be so advanced that it makes a person blind. It's better to do it at an earlier stage rather than later, and it's therefore worth people not deferring it, especially if they're healthy and otherwise pretty well. Cataract surgery comes at a time when people often have had other medical interventions, things like a colonoscopy, for example. And when people have had those sort of experiences, they'll find that a cataract operation is relatively straightforward compared to those things. Sedation, meaning there won't be much recollection of what happens. No pain because there's numbness of the eye and anaesthetic, so it's possible to do all this. And the common question people will say at the end is, when are you going to start? So they can't even remember having it done. For people that have never had a procedure before, I think it's very important to understand with them the notion of letting someone do something to them. Having said that, I think the measure of how well this works is that looking at the results of the first and realising how well people have done with one eye, there's usually very little hesitation deciding to do the second one. The basics are the same for everybody. It's the technique of removing the cloudiness safely, retaining the tissue in the eye to support the lens implant, and the main decision is what sort of lens implant we'll use for people. That'll be dictated by assessing the shape of their eye and what sort of focus we can give them, how the focus will work between the two eyes, and whether what's called an extended depth of focus lens might be suitable for a patient. That will help minimise their need for spectacles, or what we call monovision, where one's a little bit better suited for one distance and the other for a slightly different distance. They're the main options. For people with glaucoma, there's an option to have what we call a stent used as well, and that is usually very successful. And for most patients needing drops to control their pressure before surgery, it will get them good pressure control with the stent and not needing their drops after their surgery. Most people have got a little bit of a sense of if there's a problem, that there's swelling or infection, for example, or bleeding. That'd be the common things that are understood by many people, and that applies equally to cataract surgery. Depending on the type of anaesthetic, the eye might look a little bruised or red from the surgery. The main concern will be any risk of an infection happening in the eye. What reassures people is the notion that we take that very seriously. As distressing as it can be treated, but our emphasis on prevention. That's why surgery is done in a proper operating room. Our routine in handling the instruments and maintaining sterility during the surgery, and sensible use of antibiotics to prevent infection, give us a very low rate of infection.